Hi, my name is Raven Lirio, and I am a senior communication major here at Pacific Lutheran University. I am so excited to share my final capstone presentation on the pediatrics firm Southsound Pediatrics, which is located in Olympia, Washington. I am currently employed as their media consultant and manage both their website and social media platforms on Facebook and Instagram. With my capstone presentation, I created a marketing plan for their practice since they have just gone through a rebranding and are hoping to solidify themselves in social media presence. In this marketing plan, I'll be talking about not just their social media, but also some plans to create video content and increasing their visibility overall in advertising. Some background about the practice is that Sasan Pediatrics is an entirely women owned business. All of the physicians, support staff, nurses, nurse practitioners are all women as well. At the same time, between all of their staff members, they speak 5 languages fluently, which make them the most diverse pediatrics firm in Thurston County as well beyond. And the hope would be to help them advertise themselves to new clientele as well as to increase their current user interactions on their social media platforms. Some of the goals of this marketing strategy is, as I mentioned before, to increase their social media engagement. Because they have gone from an old branding and name to a new one, they are starting completely fresh at scratch with 0 likes and trying to increase their user interactions on the new website as well as their social medias. And so the hope would be that since we're starting with a fresh, clean slate, we can increase social media engagement and make that something that patients expect and know our practice is known for. Additionally, we'd like to update the new website with all of the new content we're coming out with in terms of video and social media so that all of our platforms are being updated consistently across each other. Secondarily, as I mentioned before, the hope would be to increase visibility of the practice in terms of search engine optimization on Thurston County and beyond. They are a very diverse and inclusive practice, and they don't advertise themselves as such. And in fact, they didn't realize the importance of them being so diverse and inclusive to their patients. And so the hope would be to secondarily make it known to the greater public what services they offer and what their practice has that sets them apart. In addition to being diverse, they see both government aid and private aid insurance, which sets them apart from their competitors who don't normally see government aid insurance patients. In terms of when we plan to evaluate this, the hope would be that by December, end of this year, we'll be able to evaluate our starting numbers of likes to our ending numbers, as well as looking at our business insights to see how many users have been interacting with our page and evaluating how well we've been doing in terms of checking in with patients and making them feel like we're more of a community and care for our clients. And the biggest part of this marketing strategy is how are we going to accomplish all of these things? And I have two um, essential things that I planned on doing to help them achieve their goals. One of them is a themed social media post per month. And so hopefully we would be able to do weekly postings a few times a week and create some fun interactive challenges that encourage patients to interact with our social media and feel like they're a valuable aspect by increasing two-way communication between our patients. And so it's not just us communicating to patients, it's patients also communicating back to us. The other thing that we really wanted to utilize and emphasize is creating visuals to capture new clientele through videos. Right now, there is no advertising that's being done for the practice other than our social media pages. And the hope would be that by creating videos, we can visually capture and stimulate our current clientele to know the services we offer, but as well as bring in new clientele. So if they're interested in what we have, they're able to see for themselves visually what our practice looks like, who our staff are, and all of those factors. So in terms of the website recap and comparison, our current website looks like this. This is a hyperlink to our website. It is partially animated, so the logo is new and updated. When you scroll down, different buttons pop up at you, which sets us apart from our competitor sites, which are much more newsletter style, a little bit plainer. A lot of them seem to have not really updated from the last couple of years. It's very basic HTML kind of a look. And so we've set ourselves apart by being kind of useful and hip and more in touch with our younger mothers, as those are our current clientele. And so our hope is that our social media will equally represent our website in being in touch with our user base. So, in terms of deciding where we were going to advertise, in a study done by Infinite Dial by Edison Research, which is a research company that also does the exit polling for official elections, there was a study done for 2021 on mothers and social media usage. And what they found is that 93% of mothers use social media of some kind. And the biggest three that were used were Facebook, Pinterest, Instagram, and recently TikTok has been on the rise. We currently, because we are starting out fresh, already have a Facebook page and have just started to use Instagram. And since those are where our mothers are really located, and because it's a pediatrics firm, patients are children and their parents bring them in. And with our patients, it tends to be that mothers are the ones bringing them in. So we are focusing mostly on mother social media. um, we will be using Facebook and Instagram and increasing our visibility there. Eventually, we may branch off into TikTok since it has been on the rise, but it is not a priority of ours since we would like to focus on doing the things we can do well first before starting an entirely new endeavor. In terms of social media themes, I came up with the kinds of themes that may go for each month for the rest of the year, starting from March down to December. I also talked about different events we could do in relation to the themes that I highlighted. The themes include not just healthcare related events like autism awareness, national bullying, diabetes awareness, mental health, but also emphasize events that families normally celebrate or take part in to try and connect us better to our user base. These include things like Women's History Month, including events that deal with going back to school or Thanksgiving or Halloween. Those are kinds of bigger events that families do as a family activity. And so we really wanted to emphasize those things by creating fun challenges that children and families can do together in combination with our healthcare incentives. And so I will be highlighting for the month of June. I had plans for a reading literacy event since we have a partner that works with us, South Sound Reading Foundation, that helps us with making sure that children are constantly reading and being exposed to literature and books. And so I will show an example of what one of these events might look like in a later slide. In terms of our posting schedule, we don't currently have the data for when our best days are to post. And this is our Facebook page, as you can see on the two pictures on this slide. We currently have 121 people that have liked our page, and it's been increased since we just started and transferred over. But we want to make sure that um, we are prioritizing that um, data first so that we can get the best information about when we can post. So that'll be happening during the months of July and August. We hope to post 2 to 3 times per week. It'll depend on when we get the most user interactions, what days we have patients that are interacting with us the most. We also have decided that we're going to use hashtags, especially for awareness challenges and posts. In addition to that, we are wanting to include the year at the end of those kinds of challenges. So, for example, we have Diabetes Awareness Month, and then we have SSP, which is South Sound Pediatrics, Read 2021, which is the hashtag I will be using for the Reading Literacy Challenge in the month of June. And we've attached 2021 so that we can catalog that this is what we did for the year 2021. And then when we have another challenge in 2022, we have a catalog of all the things we've done in previous years as a comparison. And then we can gauge if we have more engagement one year than another one and figure out what worked the best. So, That's the plan with terms of posting and how we're going to be getting the data to determine how best to interact with patients. In a kind of post breakdown, we have three kinds of posts: giveaways, awareness posts, and events and activities. These are some examples from our current Instagram page. Two of them are giveaways. One's really a giveaway, the other one was a free drive through event to give out free diapers. So we have those as an example of giveaways. The center post deals with Women's History Month, which is an awareness post. And finally, we don't currently do events and activities, but I would love to begin to incorporate that into our practice to increase user interaction. And I will be breaking down samples of what these could look like using other practices, social media pages as inspiration. So, examples of giveaway posts. This is from an orthodontist office, which is known for giving out lots of giveaways and has been very successful. And so, these are some of the prizes they put together in these little baskets, trying to encourage people. They have ways to win, would be answering their trivia question, commenting on their posts, liking them, sending them a review. And we hope to utilize all of those strategies in our giveaways to try and incentivize more people to interact with the logistics of our page, like liking posts, commenting, all of those aspects. In addition, we also have awareness post examples. This was a um, sexual awareness assault um, post that was used by Campus Life, which is an office that I currently work for at PLU. In this one, we had students take pictures of themselves wearing denim in solidarity, and they would send us the images and we would put them onto our story. And so, our hope would be to do the same for our practices for like mental health awareness, create a challenge, have patients send in photos or do some part of some challenge that goes to us that we can then share and show not just our current patients, but anyone that's interested in our page, that our patients are indeed engaging with us. Finally, I have an event example post. These are from the PLU chemistry page. I am the current public relations director for the chemistry club. And so these are some stories that we've utilized to try and get students to interact with each other. We hope to do this similarly with Facebook and Instagram since they are linked, that we can do these kinds of challenges on our pages and hopefully get moms to interact that way as well. Two of these examples are kind of bingo fill out cards. You X them out and tag friends. If everyone fills it out and gets a blackout, then they will get a special prize for blacking out their summer bucket list board. So those are all things that we're hoping to utilize and increase as the summer rolls around. So this is the example I was talking about previously, which is a literacy challenge. This is Dive into Reading with South Sound Pediatrics. I created this poster in Illustrator, and it includes our hashtag on the bottom of the poster. And this is to incentivize people to join off the wall of the clinic. At the same time, we also want to advertise this on our social media. And so our thought process was to make a kind of bingo challenge or potentially a cross off of books. We would make them for different grade levels and ages. Since we do partner with South Sound Reading Foundation, we have a list of books that are recommended that children read around that age. And so hopefully we'll be able to use those books, create a kind of checkoff list, and kids that fill out their whole summer reading will be entered on a board of summer readers. We'll come up with a cool title, and then the children will get their picture taken and go up on the wall, and it'll incentivize children to read, thus helping push our healthcare incentives as well as making a fun challenge for families to do together. As I mentioned before, we're really trying to increase the interactions on social media. So, on the left is the social media plan I've outlined earlier as a recap. The other thing I mentioned at the beginning of this presentation was creating video content. The real hope is that we're going to create a YouTube channel and have a full commercial, which I have the storyboard visual at the end of this presentation. And I have created a full voiceover script, which I will be filming, editing, and voicing over the summer. This will be a commercial that advertises all the stuff we have to offer and really showcase what our practice is, where we're located, trying to get people to come. I also wanted to create meet the staff videos and two specific videos on the diversity and inclusion aspects of the practice, as well as potentially doing patient testimonials. We have them in written form, but to get them into a video format would be fantastic because then people can see real patients talking about their experience. And hopefully, all of those videos will translate and the social media to the website, and we hope to have a social media feed on the main website directly, as well as linking those videos like the Meet the Staff videos onto direct bios so that patients, especially new patients who don't know which physician or support staff they want to be talking to, can watch how they talk, can hear more about them, and determine who it is they actually want to sign up to be their physician for the next few years for their child. Additionally, because of the rebranding, a lot of the stuff on Google isn't currently updated, so we're going to update all of their information so it's all consistent across all the platforms. Finally, breaking into the commercial storyboard I mentioned earlier, these were the key highlighted points that the practice determined were the most important that they wanted to emphasize to future and current patients. And so I took all of these highlighted points and created a visual storyboard. And these are pictures of the practice with some stock images in to create a comprehensive video. So we have the welcome, history, hours and location, the fact that they see government and private insurance, who their partners are, emphasizing the multilingual aspects, and then website information, boilerplate, how to schedule an appointment. And finally, my final goal would be to animate their otter logo at the end and create a slogan for their company. The current stand and slogan is South Sound Pediatrics, where your child's health comes first. And the hope would be that eventually we flush that out in detail over the summer to create a video to go up on social media as well as our website. So this concludes my capstone presentation for communication. Thank you so much for watching, and I thoroughly enjoyed working with this company and look forward to expanding on this marketing plan in the future. Thank you.